Okay. Hey, everybody. I am here today with one of my very good friends, Dr. David Ballard, to talk about mental health in the workplace. Because I just learned that World Mental Health Day is Saturday, October 10th. It's coming up. And Mental Health Week in the US has been this past week. And if there was ever a time when we need to be talking about mental health, it is now. So instead of me talking about it, because I am not a mental health expert, I asked my friend, David Ballard, to join me and talk about mental health, because truly when I tell you he is the expert, let me give you a little bit of background. He is currently located out of Ireland. He relocated there recently with his family. And before he relocated to Ireland, he was in charge, and stop me, David, if I get this wrong. He was in charge of the organizational excellence at the American Psychological Association, and that included the psychologically healthy workplace program that they had. He's also the author of this great book, co-author with Matt Grawich, called The Psychologically Healthy Workplace. And one of the many projects he's been working on now is this fantastic resource for managers. He was the expert consultant to it with AXA and Columbia University, called Supporting Mental Health of Employees During and Beyond COVID-19. So again, you can see why I decided, hey, I'm going to talk to David about this, about mental health, how we can support our people, what managers can do in this really challenging time. So hello, David.
Hi, Kelly.
It's so good to see you.
You too.
All right. So I'm going to share with you what I am hearing from leaders. And it's essentially this, that if it was just COVID-19, that would be one thing. But it's not just COVID-19. It's COVID-19 layered on top of economic worry, layered on top of concerns about social justice, layered on top of concerns about political unrest. It's just a lot. And again, I urge everybody, and I will put it in a link in the newsletter and the blog post that we're going to put out with this interview, this wonderful, wonderful resource for managers supporting the mental health of employees during and beyond COVID. Fantastic resource. But if you were to say to a manager who is right now dealing with the mental health issues of their employees in real time, what would be 3 things that they could do today that would make a difference right now?
Yeah, and thanks for raising this issue. It is a really important one, and I'm glad to see employers are paying attention to it right now. And thanks in advance for sharing the resource. I was fortunate enough to work with Kathy Pike at Columbia University and the World Health Organization Center for Global Mental Health there, as well as Stephen Bevan from the Institute for Employment Studies in the UK on that resource. And there's a whole lot more in there than what I can talk about during our conversation today. So I do encourage you to check that out. And you're right, it's hard to believe how much has gone on this year and how much continues to go on. I was recently doing a presentation, and I listed out some of the major events that have occurred since January of this year. And I was exhausted by the time I got to April. And even since then, there's been more and more. So I think, yes, even if it were just the pandemic that people were dealing with, I mean, that would be more than enough. But we have all these other issues piled on top, and stress is cumulative. So the things that people are dealing with go above and beyond normal experiences. So, you know, that's one of the first things I encourage everyone to think about this as, you know, these are unusual circumstances that we're going through. So rather than pathologize it and think, you know, people are struggling and having all these problems, these are pretty normal reactions to a very abnormal situation and culmination of various things that are going on right now. So I guess I should get to your question now.
Well, no, I think that's a really important framing, because again, I love what you just said. It's not pathologizing a very normal reaction to a very unprecedented set of circumstances. So that's, I think, a great framing to just say, look, this is just normal what people are feeling. So now what do we do? How can we help people?
Yeah, and people's experiences, run the gamut. So you can't even assume that what one individual is experiencing is even remotely the same as what another is going through right now. So, at any rate, if I were to give just a few things that I think managers could focus on right now, the first would be communication, and I mean two-way communication. So that needs to go up from employees in the organization. They need to involve employees in meaningful ways and get input and feedback and listen to them. Otherwise, they're not really going to understand what employees are going through and what their needs are right now. So they need to assess what those needs are and act early. Don't wait until employees in an organization are in crisis. Take steps now, tease out what issues might be popping up for people and take steps to address them early. It also includes downward communication and talking about these things. They're not easy subjects to talk about, but it's important to make mental health part of the conversation. Every one of an organization's health and wellness related communications should include some aspects of mental health or psychological well-being in it. That's part of overall health for individuals. So make sure you're including mental health in those communications and normalize and destigmatize what people are going through. Everybody's faced challenges, everybody's experienced struggles during the pandemic. So we should just expect that people are struggling with a variety of things right now. Acknowledge and normalize it because people are experiencing it, and encourage them to use mental health resources and supports that exist, whether that's the EAP, whether that's the behavioral health benefit through their health plan, the emotional well-being resources through a wellness program. Promote the use of those healthy coping skills and well-being really broadly, provide a ton of information and educational resources about mental health, wellness, stress management, substance use, healthy sleep, all the things that are going to help people get through this difficult time. So communication is the first one. The second thing I would say is show some leadership. This is time for leaders and managers to step up, set a clear course of action, and reduce some of the uncertainty and ambiguity where you have some control over it. There's so many things that are outside of our control right now that if you as a manager, you as an organizational leader can reduce some of that's not needed, that will help immensely to take that out of people's lives. They've got enough on their plate right now, so reduce some of that. Promote and model the behaviors you're trying to foster yourself as a leader and a manager. That means including self-care behaviors, anticipating employee needs, taking steps to reduce work stress that's unnecessary. But as a senior leader, don't just do that from the top level and think it's going to trickle down. You need to explicitly train managers and supervisors to use supportive supervision techniques, to make sure people are taking breaks and taking time off during the day so that they don't burn out, to promote civility, to address any occurrences of aggression or bullying before they turn into something bigger in an organization, and train supervisors on mental health literacy so that if there is a problem emerging in some of their employees, they'll be more likely to be able to identify it and have those difficult conversations with employees and encourage them to tap the resources that are available. And then the final thing I would say to managers is be flexible in how, when, where, and how much work that people are doing right now. And again, this is something leaders should model themselves. If you're in a senior level position in an organization, you probably put in a lot of hours and you probably thrive in that kind of environment. But if you're modeling to your employees that you should be burning the candle at both ends and never sleeping and working all evening and on weekends and so on, that's not a good approach. And overall, your team is going to suffer in the long run. Our routines are going to continue to be affected by this pandemic, and we can't even anticipate all the ways that things might change. So it's going to fluctuate. There might be additional waves that happen with the pandemic moving forward. And so we have to be flexible and responsive to that, accounting for what employees might need at the time, knowing that could change day to day and it's different employee to employee.
Excellent. I could not agree with you more on every single thing that you said. So just to recap, communication up to understand what people are facing and what they need, communication down making sure people understand what the resources are, make sure that people understand priorities, try to, you know, create some sense of order around what people are being expected to do, and then really encourage that flexibility in how, when, and where people are able to work so that they have some degree of control over how they're able to operate in this period of time, and really learn how to have this mental health conversation as part of the day-to-day management of the organization, especially right now, because this is real. Like, you can't just put blinders on to say, you know, we're just going to heads down, do the work. And you know what, that's not my job to think about that. And I think this is an opportunity, you and I have talked about this, an opportunity for managers to begin to understand the role that mental health plays overall in people's productivity. And I was talking about a statistic, something like a third of managers hadn't even asked people how they're doing. And part of it is, it's like, they don't know what to say, right? Or how they would action on it. But I also think it's partly this mindset, like, again, you know, they're here to do a job. Like, what role does mental health play in the legitimate ability of people being able to perform on their jobs?
Yeah, I think there's a lack of understanding about mental health, like you said. There are a lot of misunderstandings about mental health as well, and unfortunately, there's still stigma that exists. And even though we know from surveys that stigma has gone down overall in the population, and in fact, when people are asked, would you feel comfortable working with a colleague who you know is struggling with a mental health issue, a majority of people say, yeah, I'd be fine with that. But if you ask those same people, would you be comfortable disclosing a mental health problem you were having to your manager or supervisor? That number drops way down. Because people are worried about if they disclose having a mental health issue, is it going to hurt their chances of getting a promotion? Are they going to be seen in a negative light? Or are they not going to get the prime assignments and interesting jobs that they want? Are they going to be subject to, you know, gossip at the water cooler and people talking about them? And so people still don't talk about it. But there are a few things that I think managers and everybody in the workplace really need to understand. First of which is mental health issues are really common, and we don't talk about it very much because of the stigma. So a lot of people still think it's really rare. And if you look at the estimates, they vary. They kind of run all over the place. But in the ballpark, approximately 1 in 4 people experience a mental health disorder in any given year. And in the course of their lifetime, almost half of people will experience some kind of mental health issue. So it is very, very common. Now, the good news is mental health issues are also very treatable. And in fact, mental health issues have higher treatment success rates than most physical health conditions. So treatment works. We just don't talk about it very much. Another thing that I hear employers worry about sometimes is the cost of mental health services. They're worried that it's going to add to, you know, the skyrocketing healthcare costs that we've seen for decades. But the good news there is that mental health treatment is actually very cost effective. And other than more intensive treatment like crisis response or hospitalization that's higher dollar, outpatient treatment is actually very low cost, and it makes up a tiny fraction of what we spend on healthcare in the United States. Another misunderstanding or lack of understanding is that mental health resources that are available are underutilized. EAP is a great example of that. Most employees who are in mid and large size organizations have access to an employee assistance program, but the utilization numbers are minuscule in most organizations. And that's because people don't know the details of what's covered. They don't know how to access services. They have misconceptions that, oh, I'd only access the EAP if I was having a major mental health crisis or a major mental health disorder. And that's not really true. Those resources are there to help people manage the day-to-day pressures and stressors that we all face during the day. It's not just there for a time of crisis. It's supposed to support you so you don't get to a crisis point. So there's very often EAPs, mental health benefits that are part of the health plan, and hardly anybody uses them even though they're available. Another important point for employers to understand and managers to understand is that the impact of poor mental health is massive. So while those treatment costs I mentioned are really low, when mental health problems aren't addressed, it has a disproportionate effect on performance. And it's what some people talk about as presenteeism, where people still are showing up for work, but they're not performing at their best. They're not living up to their potential at work. Their productivity is down, their work quality suffers. So it has a major impact on the quality and productivity of their work on the job. So all this is even more important now, because if you go back for a minute, let's go back in time before the pandemic and pretend none of this ever happened. I wish. But if you look at a 2018 survey that we conducted when I was at the American Psychological Association, only half of working Americans said that their employer provided sufficient mental health resources. That's similar to the number you cited a few minutes ago about managers who aren't even asking their employees how they're doing around this. So why is having access to mental health resources important in the workplace? Well, in this survey, the employees who said that they did have access to sufficient mental health resources were more likely to say they had better relationships with their supervisors, they had higher levels of job satisfaction and motivation, they felt more valued by the organization, they felt more treated fairly at work. They were less likely to report being stressed out day to day on the job, and they were almost half as likely to say that they plan to leave the company during the next year. So, it's not just the employee well-being side, but this is having a direct impact on organizational outcomes as well. And all of that I just mentioned, that was before the mountain of new stressors were piled on top of them during the pandemic. And if you look at CDC numbers, the last ones I saw were from June, and they were reporting that 40% of US adults said that they've been struggling with mental health or substance abuse during the pandemic. 40%.
Wow.
And if you look at some of the other surveys that the federal government has done on clinically significant depression and anxiety symptoms, there's about a threefold increase from the same time last year in terms of the number of people who are experiencing clinically diagnosable levels of depression and anxiety. So we haven't even seen the full impact of this yet. We know that mental health is a lagging indicator, and during past downturns, recessions and depressions, in the US, we know that mental health problems have spiked, and they've spiked in a lagging way after the fact. So we're likely to see this play out for a long time to come, and we should be thinking about acting now before we get to that crisis. But the good thing is we can actually do that. We have the resources.
Oh my gosh, those numbers are very sobering, David. That's wow. And the fact that the resources are there, if people know how to access them, communicate what they are, help them understand how they can use them, but also yourself as a manager, truly understand and embody the fact that by doing this, you're actually helping not only your people, but also your business. And really grasping that, because I don't think there has been an understanding of what that means and what that looks like. So,
yeah, and at a benefits level, at a higher level in the organization, they should be reaching out to their vendors and providers and checking to make sure that barriers aren't in place. I mean, circumstances have changed a lot, especially if their workforce is working remotely right now. But a lot of mental health providers are providing telehealth services. So by phone, by video conferencing, and so on. A lot more of that is available, and some of those barriers have been taken down. But employers should check with their vendors to make sure that they have adequate availability from their provider network, so that their employees can access that, even if they're locked down or working from home and not able to go to an actual office to see somebody.
That is really great advice. And I would also add privacy. I think there's this concern that if I go through my EAP, if I access mental health through my employer, there's going to be a privacy issue with that. And talk about that a little bit. I mean, it's HIPAA does, at least in the United States, HIPAA does still apply, right? I mean, they can't share that information with your employer, correct?
Right. If an employee goes and sees a counselor or a therapist through the EAP, or they access outpatient mental health services through their health plan, those details cannot get communicate it to the employer. And in fact, when EAPs, even as a vendor that's providing a service to the organization, when they provide reports and data about utilization, it's all aggregate data so that they see, you know, how much is being accessed for what kinds of things, but they're not seeing individual level breakdown. So I mean, that's something that if somebody feels uncomfortable, you know, asking somebody in HR or benefits about how to access the resources, go straight to a contact person at the EAP or straight to a contact person at the health plan and ask them. They can provide the information as well. But even if you are asking about access to resources through your employer, they're not getting the clinical information from the services that you're receiving.
That's great. Very good. That, again, excellent information. Very, very, very important advice that every manager and every employer could be communicating over and over and over again. So now, David, you know, last sort of bucket of knowledge that I want to try to share has to do with the individual employee and what they can do. And in the Supporting Mental Health of Employees guide that you've put together with AXA and Columbia University, there is a section in there that does talk about how leaders should promote and model work flexibility and self-care for sure, which creates a very important environment for well-being and physical well-being, mental well-being, psychological well-being to happen. But as you and I have spoken over the years, there's a skill set, there's a way of approaching that employees then need to action on, and a set of skills and tools that they need to begin to practice. And so one of the ways you and I connected was when I wrote my book, Tweak It, gosh, like 5 years ago, which was really meant to be that skill set that individuals then use to be intentional about how, when, and where they are prioritizing not only work, but then the things that help them be their best in their personal life as well. So I know I have some ideas about how individuals right now can capture some of that flexibility and follow the lead of their manager in terms of self-care. But what are some of the small, meaningful actions somebody could take that could make a real difference in terms of their psychological well-being right now?
Yeah, it's a good point that when you're talking about employee well-being, you're talking about organizational functioning, it's a shared responsibility. Yep. And an employer can't make employees healthy. They can't make employees engaged, despite what they like to tout sometimes. But what they can do is create the conditions at work that are conducive to those things. So organizations can provide resources, they can have programs and policies that support good health, that support flexible work and ongoing development. They can make sure that employees have a voice. They can reduce or eliminate unnecessary stressors, like I talked about earlier. They can design work and jobs so that they promote well-being and excellent performance. But like the old joke goes, how many psychologists does it take to change a light bulb? One, but the light bulb has to want to change. I know it's a terrible, terrible joke, but it makes a good
valid.
Employees have to be actively involved in this, and it is a shared responsibility. So as an employee, you know what your needs and preferences are. You know what's best for you, but the circumstances have changed, and they continue to change during this pandemic and beyond the pandemic. So you might need to step back and assess how things are going right now and then adapt what you're doing or work on certain things that are out of alignment with what your current needs are. I know my needs in my own household have changed drastically between the school session that was before summer and now. Our kids were in home school where the school shut down before summer, and now they're back after summer, and that's totally changed the needs, the timing, the workflow, the household responsibilities. Everything has changed just in the matter of a few months, even on my own end. So this is an ongoing process. It's not something that you complete and you're just done with. You have to come back to it periodically, or when circumstances in your life change. So some concrete things that I think people can consider. One, make sure you're getting the necessary stress recovery experiences. Take time off, take breaks. That's hard to do sometimes if you're working remotely, working at home, and all your boundaries are blurred and a mess because of all of that. But make sure you're taking time off when you're not working, when you're not thinking about work. you're engaging in some kind of relaxation activity, whatever that is for you, yoga or meditation or taking a walk, reading a book. Engage in non-work activities that are interesting or challenging or stimulating to you, those hobbies that fell by the wayside because you got too busy for them. They're important to help us recharge. And good quality sleep and enough of it as well is really important. So those are all things you need to have stress recovery experiences. And when we're out of whack and our normal workflow and workday is off, that's sometimes hard to do. But make sure that you're doing that. Even a 5-minute break here and there to get up and walk around or go outside and stretch for a minute.
Yep, and this is where sort of the secrets of the WorkLifeFit naturals from Tweak It, I find have become even more important, which is all the good things you just said. You have to be intentional about making them part of your schedule. And what I learned from studying these naturals is they keep a shared calendar with all their work and personal to-dos on it. And when the boundaries, the physical boundaries and the time boundaries that used to sort of separate work and life disappeared with COVID, and PS, they're not really ever going to come back. I just want everybody to know in the same way they did before. So what you learn how to do now is going to carry you forward for the way we're going to work next. But there is a level of intentionality around how you have to think about what you're trying to get done at work and what you're trying to get done in your personal life that have to be on the same sort of, picture. And if you struggle with start and stop times, put them on that calendar. If you struggle with making sure you're going to sleep, then you have to actually put it down. Like, prompt yourself to use these tools that can help you organize what you're trying to do and give yourself a break. Even if you plan something, and this is one of the other wonderful lessons I learned from the naturals, is celebrate success. Don't go for perfection, because I think with time, sometimes what happens when people start to be really intentional about what they're trying to do, if they don't do everything and they're like, okay, forget it. I wanted to take a walk 3 times a week, but I only took it twice, so I'm not going to take a walk. It's like, even 2 walks with your partner or with a friend, social distancing, that can make such a difference to how you feel. And if something came up that you couldn't do that 3rd walk, well, you know what? You'll do it next week. And to your point, David, this is something that's just going to be managed over and over again. And this is where you and I both align on the magic of WorkLifeFit, which is it's about this ongoing management of how your work and life fit together. And there's no balance. Integration is like the reality right now, but you've got to find boundaries within that integration. And that's your fit. And so the more you can, as David said, step back, understand what it is that feeds you, like that fills you up, and make sure those things are happening intentionally can go a very, very, very long way. And give yourself a break. We didn't have to do this necessarily beforehand, because again, you could say, I'm at work. This is when I do work. This is when I do life. That's not happening anymore. So, I think, one of the things I want to just reinforce that David said is your managers and your organizations can create the environment where this can happen. But you as the individual need to reach out, grab it, and then action on it. And I even would argue that some of the problems with EAP and wellness programs is that we didn't teach people how to fit all that stuff into everything else they were trying to do. So, grab those resources from EAP, grab those resources from your wellness program, but then you've got to think about, okay, how am I going to make that part of what I am trying to get done at work and in my personal life? So.
Yeah, I think a lot of organizations, due to the pandemic, have had to rethink how they even offer some of those things. If you don't have people who are taking the hour during their lunch break to go to the yoga class or to the fitness room that's in the building, organizations had to figure out how they deliver some of this remotely. How do they break it into bite-sized pieces so that people who don't have an hour to take during the day can go spend 15 minutes and do some of these things to recharge. And it all comes back to self-care, all the things that we know we need to do. Most of us are not very good at it, but we know it nonetheless that, we need to eat right and drink enough water and exercise, get outside and get some fresh air where we can. And then I'd say back to the resource issue, use those resources. If you have a mental health benefit, if you have access to an employee assistance program, if you have wellness offerings that your employer has available, if you have trainings and opportunities to develop new skills that are provided, use those resources. And it is tough sometimes to squeeze it in, but they're all things that will contribute to your well-being in the long run. The other two things that I'd suggest for people right now, one, stay connected. With all the physical distancing and remote working and everything else, it's been difficult to maintain those social connections that we took for granted sometimes, just passing by somebody in the hall at work or during lunch and having those conversations. But social support is critical to people's physical health, mental health, overall well-being and functioning. It's been encouraging to see the creative ways people have found to stay connected, whether it's virtual happy hours or Zoom get-togethers, whatever it is that helps you stay connected to friends and family and coworkers. Those are really important things. So social support is critical to resilience, and this is a time when we need to rely on resilience. And then finally, limit your media exposure. Back to
Yes.
your earlier point about everything that's going on in the world. There's so much that you get bombarded by on news sites and social media. It is nonstop, and a lot of that is very negative and very divisive and inflammatory. So it's very easy to get overwhelmed. And yes, you need to stay on top of what's going on and be aware, but focus on a small number of reliable, high quality sources of media information. Know when you need to cut it off, that it's going to overwhelm and stress you out, because being exposed to that constant barrage 24/7 of all these issues going on right now, it isn't healthy. People need to take a break. And to your point about, you can't always get everything done in a day. I'd frame that as cut yourself some slack. It's okay not to be okay all the time. I would venture to guess that all of us, or most of us, have had times during this year when we've had a bad day, when we were irritable or we were tired or we weren't being productive and felt like we couldn't get anything done, or our thinking was cloudy and we're having a difficult time, making decisions or doing our work, in a cognitive sense. We all have those times. Sometimes you just have to cut your losses and do something for yourself to take care of yourself. And not beat yourself up. And that's easier said than done, but sometimes you just have to cut it, take a break, recharge, and come back ready to go next time.
Excellent advice. Excellent advice, my friend. Well, again, see, everybody's listening to this can realize now why I chose to talk to Dr. David Ballard about mental health as we approach World Mental Health Day on Saturday, October 10th. And again, as David very eloquently pointed out, there's a lot we can do. And David, I can't thank you enough. It was so good to see you. And I'm sure this is a conversation that is going to continue beyond this moment.
Absolutely. So. These aren't new issues. These issues existed before the pandemic. They'll still exist when we get through it. All this has done is magnify the issues and put a focus on it right now. So, we need to take some steps to address the current issues. But if we're smart, we'll think about this in a really strategic way and make some decisions that'll be good for well-being and functioning in the long run, even after the pandemic.
This is actually the ultimate goal, right? And getting through now and then beginning to think about how we can take this all to even being better, stronger, and what's next. So, David, thank you so much.
Thanks, Callie.
All right, take care.
You too.
Bye.